Hello, good evening everybody. Welcome to our video event to talk to you about the North Wales Dental Academy. For those of you that don't know me, I'm Pete Greensmith. I work for Betsi. I am the project director for the North Wales Dental Academy, amongst other duties in dental. It's my pleasure to welcome you all here tonight. We're going to give you some background on the project, but before we start, housekeeping for you all. If you can all stay on mute, if possible, while we're doing the presentations, that would be helpful. If you have any questions that you would like to ask us, if you can type them in the chat, we will have an opportunity at the end where we'll try and answer some of those questions. Any of the questions that we don't answer, we will come back to, and we will send you all out a list of questions and answers to the email addresses that you registered with for the event. So we've got a quick relaxed format for you this evening. A quick welcome now from me. I'm going to hand you over to our stakeholders in a minute to welcome you and tell you what the project means to them from their perspective. And after that, I will talk through some more detail on the project and the proposal and what it is that we're looking for from a prospective partner in this, and give some idea of some of the timescales. This is a very early event, so I'm not going to be going too much into the specifics of what it is that we're looking for and expecting, but just a very high-level overview so that you can gauge a level of interest in the project moving forward. So that said, I'm now going to hand you over to Dr. Chris Stockport, who is the Executive Project Sponsor for North Wales Dental Academy from Betsi. Very smooth there. I managed to not hand you over to Chris Stockport. So, Chris, I thought you were here, but maybe you're not. But anyway, I will do a little bit more of an introduction. So, from a Betsi perspective, this is an important project for us. We have several issues in North Wales that have dogged dental for a little while now, access being one of them, and recruitment and retention of dentists being another. So that's our key focus in trying to address those issues with this project. We've got some videos from our partners. So this project is a Betsi-led project, but we're working in collaboration with Welsh Government, HEIW and Bangor University. So I will now ask Becca if she can play for us the video from Paul Brocklehurst, who's the Deputy Chief Dental Officer for North Wales.
Is Paul Brocklehurst, and I'm one of the two Deputy Chief Dental Officers for Wales. And I'm here today to talk to you about the North Wales Dental Academy from a Welsh Government perspective. So what is our involvement and why? This initiative is very much grounded in two policy documents, which you see on the right-hand side there: the All Health and Dental Services Response to a Healthier Wales and Prudent Healthcare. So for us, the North Wales Dental Academy is rooted in our policy objectives to do the following: increase access to new patients with higher needs, adopt a preventive approach to care for all, extend the use of skill mix as part of prudent healthcare, provide high quality evidence-based care, and prompt patients to attend according to need as measured by the ACORN tool. So why the project is important to us? Well, we see this as a flagship project for Wales, breaking the link with the UDA activity, instead focusing on quality of care based on need, to drive innovative change in the provision of care and adopt working methods using the whole dental team. It's also important because it will provide service provision with educational opportunities and provide development opportunities for dentists and DCPs across North Wales. Our ambitions for the project are that it will become a flagship contract reform practice in the North. It will increase access to NHS dental services in North Wales, and it will provide services to meet need. Equally, we see it as providing educational opportunities linking to the All Wales Faculty of Dental Care Professionals and providing educational opportunities to develop dentists with special interests, and for those that are interested, also research opportunities. Overall, it's really to meet future population health challenges. So what does innovation mean to us in the Welsh Government? Well, it's about pioneering change. It's about providing access out of working hours to those with the need, very much abandoning the UDA mindset, providing acorn-led integrated care, potentially the use of digital technology, tier 2 referrals, and cascading education through peer-to-peer training. And for those that are interested, developing their primary care research skills with Bangor University. We hope that's given you a snapshot of why we think the North Wales Dental Academy is important to the Welsh Government, and we look forward to hearing from you later. Thank you.
Thank you, Paul. I think it's really important for us to be able to hear the perspective of Welsh Government and why this project is so important, both in terms of their view and for us here in North Wales. Next up, we have a video from Dr. Adrian Thorp from HEIW, giving the HEIW view on the project.
Good evening. May I introduce myself? I'm Adrian Thorp and I'm speaking on behalf of HEIW this evening, although I do have multiple roles within the Health Board and also on this project. As a little bit of background, I own a 7-surgery primary care practice in the east of North Wales, and I'm also a DPA for BCU, but I speak to you tonight as TPD for Foundation Training for HEIW. For those who do not know Health Education Improvement Wales, HEIW, we are a special health authority established in October 2018 and sit alongside other health boards in Wales. We have an all Wales remit, and our vision is to transform the workforce for a healthier Wales. We have a budget of around £215 million, and 90% of this is spent on training and education. Our function is far wide and reaching, including workforce planning, strategy, and modernisation via education and training. If there's anyone to blame for this project, it's probably me, as I had the initial idea of developing a training academy in North Wales. I could see two main issues that could be addressed via training. Firstly, I saw that we could recruit and support the retention of dentists and DCPs here in North Wales. Evidence shows that most new graduates want clinical training to upskill for the future. So we need to tap into this valuable resource and develop educational pathways to suit our local population. The Academy is well placed to do this. The encouragement via training will bring applicants to North Wales, and then these highly skilled trainees would eventually become practitioners staying in North Wales and committed to improving the health of a population. It may seem an uphill task, but I've shown recently this works by developing 2 clinical dental fellows here in North Wales to encourage Welsh graduates to remain and further train in Wales. This has encouraged upskilling, promotion of self-wellbeing, and the longevity of these professionals remaining in North Wales. The second issue that could be addressed was the need to upskill our local practitioners within primary care. Here lies our greatest asset. These practitioners already work and live in North Wales, but in my opinion are not fully utilised. The majority of dentistry is carried out in primary care, and these are the forgotten tribe. Many practitioners feel stagnated and trapped, and the thought of utilising the Dental Academy to encourage development and upskill this group for the next decade. In addition, fully utilising skill mix, encouraging all the dental team to work to their maximum level rather than their minimum. Dental care should be provided at the point of contact by the most suitably trained professional. We need to assist with our asset of dental care professionals in North Wales with the development of prudent healthcare, again within the Dental Academy. So what do I want to see from HEIW from the bidder? Well, ideas of how to upskill our local network of professionals, ideas of how to aid recruitment and retention of professionals, utilising foundation dentists, dental core trainees, local specialists, dentists with enhanced skills and consultants via training, and ultimately utilising all the above under contract reform and the Healthy Wales document. I'll be round after this to discuss any questions, so if there's anything you want to ask from a HEIW point of view, please hold on after.
Thank you, Adrian, both for the video and also for the idea in keeping up the pressure of establishing a dental academy here in North Wales. The final video that we're going to play for you tonight is from Lynn from Bangor University.
Hi everyone, I'm Dr. Lynn Williams, Head of the School of Health Sciences at Bangor University. I'm a member of the North Wales Dental Academy Oversight Group, bringing a perspective from Bangor University. I'm really excited for Bangor University to be part of the North Wales Dental Academy, as it represents an opportunity for innovation and growth of healthcare training, education and delivery across the region. The School of Health Sciences at Bangor University has a strong reputation for supplying healthcare professionals into the workforce, both locally and nationally. This collaboration with the North Wales Dental Academy will support the continued investment and growth from Bangor University in the local workforce by training, recruiting and retaining dental professionals across North Wales. Bangor University intends to deliver undergraduate dental hygiene in September 22 as part of the HEIW Commission. If successful, this will require up to 15 students to complete clinical placements in primary and secondary care across the region. It is envisaged that the North Wales Dental Academy will play an important role in facilitating first and second year dental hygiene placement students. With students placed in an innovative clinical environment, working to a contemporary contract structure, we will ensure that the students have the clinical skills and experiences appropriate for the future needs of the sector across Wales. With a growing portfolio of DCP education, training and support developed by the All Wales Faculty of Dental Care Professionals at Bangor University, there is an ever-increasing number of opportunities for us to facilitate, collaborate and innovate with the North Wales Dental Academy on pre- and post-registration education and training for all members of the dental team. Within the College of Human Sciences, we've also led the development of a clinical academic pathway here at Bangor. It provides a flexible framework for multidisciplinary clinicians to engage in applied health research or improvement-focused work as part of their clinical career. This provides an opportunity to develop the whole of the dental team, from the practice owner, their associate dentists and their DCPs. It also provides the potential of developing dentists with special interest, working with key stakeholders, including Health Education and Improvement Wales. As part of the partnership approach, we collaborate with research groups and other schools within the college, namely the School of Sports, Health and Exercise Science, School of Psychology and School of Medical Science, and the School of Education. Currently, the projects in the clinical academic pathway focus on paramedicine, medicine, nursing, dietetics and dentistry across BCUHB and West. Current dental projects include a PhD on co-designing appropriate endodontic referral services in Wales, and a Master's to explore patient preferences for NHS dental care. The clinical academic pathway provides two distinct routes leading to a postgraduate qualification, as well as providing an embedded training package focused on developing research and project management skills and knowledge, including access to mentorship and optional modules aligned with career trajectories. Indeed, as part of this programme, Bangor has worked on a number of projects that were commissioned by the Chief Dental Officer and Welsh Assembly Government in 2020. For example, a number of practitioners supported by Bangor University initiated the development of the periodontal care pathway as part of the contract reform programme. Our aspiration is for Bangor University to work closely with a service provider that shares our ambition for a strong dental workforce in the North. A provider that understands the investment in high quality, innovative education and training, and that this is a necessary part of the picture. Bangor University School of Health Sciences is in a fantastic position to share expertise and resources within the Dental Academy to build on and enhance the skills capital across North Wales. I'm very much looking forward to working with service providers who also share in this ambition. Thank you.
Great, thank you, Lynn, for that view from Bangor Uni. I think we've managed to overcome my typical technical ineptness, and hopefully Chris should be able to unmute himself now and speak to you. So Chris, if you can, please do. If you can't, I'll continue.
Okay, can you hear me now? Can you hear me?
Yep, no problems.
Perfect, thank you, and thanks for bearing with that. All I really wanted to say, and Pete, Paul, Adrian and Lynn have covered a number of areas far better than I ever could. What I really wanted to say was just welcome to this event, particularly in an evening after you've probably all had busy days. I can imagine you're all thinking about tea and all the rest of the stuff, so particularly grateful that you've turned out to listen and contribute to this. I'm Chris Stockport. I'm the Executive Director for Primary Care Community Services here in the Health Board, so dental services falls within my portfolio. And really excited, my exec colleagues and board colleagues are excited about the potential that we have here. It's a real opportunity to move dental services in North Wales forward, to demonstrate the innovation that I know is out there, and to start pushing contract reform and showing just what we can do, moving in that direction of care based around ACORN rather than UDA type focuses. Really pleased that Pete has pulled together the evening here for us. You've heard the videos already, so I don't really need to introduce those. It would seem a little bit daft, but I'm here for the rest of the evening and happy, as Adrian has said, to pick up any questions later on.
Okay, thank you, Chris. No pressure on me there, just the board and exec colleagues excited at what we can deliver from here, so I'll do my best there, I think. But I think that kind of leads me quite nicely into my part of the evening, where I talk you through the Betsi vision, and really as project director and somebody who's quite invested in this as an idea, what it is for me, what this means, and what it is that we're actually looking to achieve as we move forward. So right from the very start, I will be honest with you that the main focus that we have around this project for the first 1 to 3 years is around addressing the issue that we have with access in the West of our patch. The situation in Bangor currently is not ideal. We've lost a lot of provision from Bangor and Menai Bridge in the last 2 years, and we need to do something to address that. In part, that is the main focus for what we're looking to achieve for the Dental Academy, but the Dental Academy as a whole is so much more than that. It's actually so much more than just the objectives that I think we were set at the start here, which for me are to deliver a solution in some way in the short term to deliver that access problem, a solution for that, and also to look at the wider problem that we have around retention and recruitment within North Wales. And I believe that some of that is due to the makeup of our patch, some of the demographics that we have and some of the issues that we try and deal with in North Wales. But some of that also is that if you reach a point in your career, you're looking at developing at whatever level of the dental professional ladder you sit at. If you're looking to move on, currently you need to look at getting your training elsewhere other than in North Wales, and we need to try and address that. There's some great work being done in Bangor Uni, there's some great work that we've done supported by HEIW and Welsh Government around DFs and dental core fellows this year to try and keep some of that moving forward. And we really need to build on that foundation and push forward with that, but we need to do it in an innovative way. And I think it's nice when we were listening to Paul's video, some of the words that he was using around pace setting and forerunner and bringing innovation and a test bed for some of the good work that we need to do to progress the contract reform agenda. For me, it makes me really proud that we're talking about those kind of things in relation to North Wales, because I think, if I'm honest, I've got a big background in service development and business development and bidding for contracts and new ways of working within services. And the one thing that always used to strike fear into my heart was the fact that I would attend an event like this and somebody like me would sit and say, we're looking for innovation. And then a month or so later, a service spec and a procurement pack would come out and it would tell me an amount of money, an amount of activity, a service pathway for delivery, and basically define for me every single element of that whilst asking for innovation at the same time. So one of the first parts of my message is to say we are truly looking for innovation in what we're looking for here. This contract will not be an activity-based contract. We will not be looking at UDAs as a measure. We will be looking at delivering activity. We will be looking at working together in a collaborative way with whoever is successful in this bid for how we baseline and develop a set of activity measures and KPIs for that first period of delivery where we're assessing and trying to deal with the wave of unmet need, both from not having services in the West, but also from the impact of COVID on how we're able to work and the backlogs that that's created for us. So we have a big mammoth task available there to look at that. But what I want to do is for us to take an approach where we're looking at working, we are pushing the boundaries of the contract, we're looking at what is the art of the possible. So we are looking at what are the needs of the patient, what groups do those patients fit in, how do we look at their ACORN assessments and look at what the best course of treatment is to get them to a better place in that risk assessment on that risk profile and to move them along using all of the contract reform principles around self-care, prevention, but also at looking at how do we utilise all of the practitioners that we have available within our practice so that the best need for that patient is being delivered and that we are looking at how we work holistically across a practice to meet the needs of our patient group. Some of the access stuff is quite easy. We can open a new practice and I guarantee you will have a queue of people outside the door of that practice before it opens waiting to sign up. So if we were looking at the old way of measuring using UDAs and looking at activity, it would be a brilliant contract and people would be biting my hand off to come and deliver it. And I don't want to say that they're not the people that I want to come and work with me, but I want more than that. I want somebody who's going to work with me to look at what is the next stage beyond that, because that patient group, that need that is out there currently will plateau and we will move on at looking at what comes next. I think we need to look at access. We need to look at the different levels of access. We talk about urgent, we talk about emergency, we talk about our general practice patients who will come back through and they will be that core of the practice, and that is fine, but we need to look at how we do that for everybody and maintain that access. We need to look at the opening hours and the facilities that we're offering and the ways that we're working with our patients. So we have very successfully introduced Attend Anywhere in North Wales. It's working very successfully in a number of practices. We would be looking at how we build on that as we move through the lifetime of this contract. We'd be looking at other innovation, other technologies as to how we utilise that around access and how we best meet the needs of our patients that we know we need to flex to deliver. When I talk about innovation, I want innovation on every level. I want innovation around delivery. I want us to look at our methods of delivery, who we're delivering to, who is doing the delivery and what we're doing. But I also want us to include in that some innovation around prevention and outreach and what it is that we're doing to promote that self-care agenda. I want to look at how we take that contract reform core of utilising the practice staff in the best way and looking at how we do that and how we achieve the best results. But when I talk about innovation, it always sounds to me when I'm on your side of the table that all of the innovation comes from my way and everybody else wants to continue working in the way that they're working currently. And that definitely isn't going to be the case with what we're looking at doing here. We're looking at working together with you to meet our needs through the course of this contract. And I've already said to you quite openly at the start here that we are looking at phasing the contract. We're looking at addressing the access issues first. As we stand currently, the intake of DFs for October 2022 are the cohort that we're looking at hosting within the practice. So we will need to be adapting and looking at how we're ready to be able to take those DFs into the practice and what we're going to do with them and how we'll utilise them. That will obviously be in collaboration with HEIW, and we'll have those discussions as a tripartite discussion. But I want the way that we manage contracts and the way that we interact with the contractor who's managing this contract for us to be totally different. I want us to be collegiate. I want us to be looking at how, as we're moving through those phases, how we reprofile the contract and what we're monitoring and how we're working together to baseline and pull together the best KPIs and activity monitoring that we can to really get in there and define what the service is delivering and be able to measure that in a meaningful way. But I also want us to be able to take learning from that and share that out into the wider dental community. So, excuse me, not only with our practitioners across North Wales, but giving some of that really valuable feedback back into HEIW and into Welsh Government so that we can progress as a whole and really be at that forefront and helping to lead that development. I want us to be adaptive. You know, we're writing a service spec, of course we are. We've got some outcomes that we need to achieve. We know the activity that we're looking to deliver, but I don't want to set all of that on day one, give myself a pat on the back, and then we go away and sit and say, that's good, we can monitor that forever. We need to look at how we work together to define what the best of that is, and that can only be done when we're working together. So that progressive, innovative view extends not just into what I'm expecting you to bring back to me in terms of what you think your service delivery would be, but it's also in how we'll interact and work with you. This contract does not have a UDA baseline. That is innovative in itself, and we need to be careful that when we say that, we're not saying, I'm not going to measure you on anything. We're saying, I'm going to measure you on things that are meaningful and that we can relate back to that patient experience and that meeting the needs of our patient group. I think in terms of contract reform, things have changed in contract reform, and you know we've been unlucky in the pandemic hit us because I think there were some big changes to come in contract reform and we were ready to pick up that challenge and move forward, and it's unfortunate that that's been delayed due to the pandemic, but I'm very excited about some of the lessons that we can learn and take forward in contract reform, not just in the Dental Academy, but as we move forward across all contract reform contracts. I'm going to talk a little bit about estates because this is one of the key parts of the project, obviously here. You probably expect me now from a non-innovative perspective to tell you that I want a building of a certain size with a certain makeup, with a certain number of clinics within it that will be used for a certain task by a certain kind of professional, and I'm not going to sit here and do that. I'm going to tell you that we will be looking for a premise that will be in Bangor, somewhere potentially within the town centre, easily accessible, There's a lot of property available there, but it needs to be something that works both for the patients and the practice. So we need to look at what's available out there. There are several things in there that we will be stipulating, and when we move further forwards into the procurement process, we of course will be stipulating within the service spec and within that procurement exercise further. But I can tell you that what I would be expecting to see is something along the lines of we're calling it a consultant clinic, a demonstration clinic, a slightly larger clinic than you would normally have, potentially video linked across into a seminar room where we can do some teaching and education from, but also that would be big enough to hold the requirements for a consultant clinic or somebody who's coming in to deliver some specialist services within there with a view to upskill practitioners and to work with the DFs and DCTs to do some of that education. I've just mentioned there that we would expect to have a seminar room. It's an academy. We are looking to do training. I want a seminar room, but I don't want, people say seminar room and it strikes fear into my heart because I think of rows of chairs in a room that's a bit dusty because it gets used once every 6 months when there's a meeting and it's the only room that's big enough for everybody to fit into. That's not what we're talking about here. This needs to be a space that's adaptable and usable, accessible to everybody, you know, the type of space that you could run a peer review group or a QI session in, or you could do some teaching on a higher level or have a good debate or a good lecture held within that space, depending on what that profile of training is as we move forward. We've already mentioned we're expecting DFs to be placed here, so we'll be expecting dedicated space within the practice for DFs to use as their clinic space and not to be hopping them around vacant sessions in different rooms. We would expect space for them to be able to work in. We've talked about different methods of consultation, so remote consultations, looking to tech moving forward. Currently, I know a lot of people who are using Attend Anywhere are having to use a clinic room to deliver that out of because it's the only space available within their practice to do that, and that's not really practical, and it goes completely against the idea of being able to do remote consultation, because that is the idea. You can do it not in the clinic room and free that space for clinical space. So that's what I would expect from premises. We can have a discussion obviously at some point around premises, but that's a baseline spec for you to get an understanding. Talk a little bit around the contract. We're looking for this contract to be a PDS contract. It will be a 20-year contract. The value that we're looking at is in the region of 1.5 million a year. There will be lots of expectations on what it is that we're expecting you to deliver for that, obviously. But back to that, innovative, collegiate way of working, we need to have a lot of discussions around that. We will be phasing. You noticed I've talked a lot so far about activity and delivering the access. I've talked a little bit less about the training. And the reason for that being that the initial focus is on the access element and not on the training. However, we will be working closely during the mobilisation phase to work out the timing of when we can move from purely access focused across into training, and obviously we will need to define what that means, and we will do that again in a joint negotiation across the contractor, ourselves and our stakeholders, and how we deliver that. One of the core focuses here for me, other than access, because I've banged on about access a lot, I think I've hopefully got the message across to you by now that access is my #1 priority. My second priority really is around recruiting, retaining and developing dental professionals across North Wales, and it's really key for me. You know, I have worked in a number of different roles and I've worked in continuous improvement, and I think where I've seen people happiest and most settled into their careers is where there are opportunities available to them, and I think we have a lot of opportunity in North Wales. We have a lot of plans in the future around how we look at what we're commissioning, how we deliver some of our intermediate tier services. So there's a lot of work that we're doing currently that I think would be really great for us to be able to attract people into the area and develop them and develop a career pathway for people so that people come to North Wales and they stay in North Wales and they deliver great services, but they don't have to leave North Wales to develop their career, and that we really do offer a great environment for people to come and work in and want to stay in. So I think that's a very broad overview. I'm sure there are, I can't see the chat while I'm while I'm presenting, but I'm sure there are a lot of questions. We do have some questions that were sent in to us by some people that can't attend this evening but had already thought of some questions. I've taken you on a really quick whistle-stop tour there. It's quite high level and it's deliberately quite high level at this stage because we're not at the stage currently to be delving deeper into that. And the one thing I did forget to mention is the procurement timeframe, because that would probably be quite helpful. So we are aiming to commence a procurement in April, and we would hope to be awarding a contract in August 2021. And we would then be looking to work with that successful provider to look at what the mobilisation phase would be and when we could expect those services to come online. So I think there's something glaring that I've forgotten. It's nagging at the back of my head and I can't think what it is. And Becca's just about to point at the whiteboard. Which bit did I miss? Length. Oh, the value in the length. Yeah, so 20-year PDS contract, 1.5 million a year is what we're looking at currently. So I think, Becca, you have a question that you can ask me that's coming already.
Yeah, hi everyone, I'm Becca Hollinshead, I'm the project manager. Okay, Pete, so we've got a couple of questions. How will activity be measured and what are the activity measures and expectations going forward?
Okay, straight in with a heavy one, that's a nice one. So as I touched on earlier, initially we'll be looking at access and activity won't be measured by UDAs, we'll be looking at completed ACORNs as one of the measures. We'll be looking at practice population, but what we'll actually be doing is working with you to work out what the best activity measures are. We are looking at different types of patient when the service specification comes out. As part of the procurement, you will see that we're looking at different patient groups and different levels of access for those patient groups. So we will be baselining with you how we collect some activity around that and what activity measures we use to do that, but we'll be following the contract reform principles. So all of the measures that are currently in place around contract reform will be ones that we're looking at, but we will be looking to firm up more of that and we will give more detail in the procurement.
That's great. Okay, another one we've got here is the geographical location flexible?
I guess that depends on what you mean by flexible. I would expect it to be in the Bangor area because it's replacing provision that we've lost from Bangor and Menai Bridge. There is flexibility on where within Bangor that is, but as I'm sure you would all expect me to say, if I talk about flexible location, it has to be suitable, it has to have car parking, it has to have disabled access, it has to be on public transport routes, it would need to have either car parking or be close to car parking. There is a current desire from Welsh Government, but also from local authorities for us to look at utilising space within town centres that is becoming redundant at the moment and becoming available, and we would of course be very open to that. But in terms of innovation, we're asking you to be innovative, so we would be open to suggestions, but my direction would be we are replacing activity that's been lost in Bangor and Menai Bridge, and my focus is delivering activity back into those areas.
Okay, great, thank you. Okay, we've just had a live question come in. Will there be an opportunity to collaborate with other primary care professionals, GPs, pharmacists, etc.?
Absolutely, yeah. I mean, Chris did his introduction at the start. Chris is the executive director for, I'm going to get it wrong, community and primary care services. Wrong way around, I think. But all of primary care sits with Chris. We're talking about prevention. We're talking about self-help and people taking charge of their oral health. But actually, that does link out further across primary care into people's general health. We also have a primary care academy which has been established in North Wales, which is looking at similar issues to what we're looking in the dental academy. The dental academy will actually sit as part of the primary care academy within our structure and be managed in that way. So yes, we'll be forging links across all of that. We've had a lot of conversations recently with the LDC around clustering both within dentistry, but also access into the wider primary care clusters to work collaboratively across all of primary care, with dental playing a key role within that.
Great, thanks Pete. Some more questions coming in. For this contract, how quickly do you want this clinic up and running? If you want to answer that one first.
Ideally 2 years ago, but realistically, as soon as we can, but not in a rushed manner. So I would hope if we award a contract in August that we would be able to have a plan to get access up and running within a clinic very early into that mobilisation, and we would need to have a discussion about fit out. We need to find a premise. So when I say very early, I'm not naive. I'm not saying I'm going to award a contract in August and I want it up and running in September. I would say that we would have a very healthy discussion with whoever the successful bidder is around what steps we can take to support the estate that they find and to get a clinic up and running in as short as time as possible.
Great, thank you. Okay, how do you want to split the contract? I understand main idea is access, but is there an idea for how many dentists, therapists and hygienists, etc.?
I would like you to tell me that. I've said quite a few times about innovation. It's not very innovative for me to tell you the staffing model that I want you to deliver the contract with. What I want you to do is to keep in mind the principles of contract reform, and I want you to come back to me with a proposal that tells me how you would split the contract. So there are, as we know, certain parts of a patient journey that can only be done by a dentist, but there are a number of parts of that journey that can be carried out by other DCPs within a practice. I would expect you to model any response that you submit to us based around those principles.
Okay, will you open to the initial CapEx investment required for new premise and infrastructure, or does that come out of the 1.5 million per annum?
There's capital funding available from BCU and Welsh Government that we will be spending in 21-22. We haven't bottomed out quite what that figure is yet, but we would still expect some commitment from whoever the successful provider is to give some capital input into that too, but there is some support there.
Okay, next question. If NHS access improves, needs for secondary care increases, what is Betsi Cadwaladr doing to meet those needs, e.g. paediatric, GA services, sedation services, intermediate tier, currently in the CDS and HDS, but very stretched?
Good question. I alluded earlier to the fact that this is only one part of a wider overview and review of commissioning in North Wales. All of the services that you mentioned in your list there are on my list. Anybody who's been to my office in Rill will know there's a whiteboard in the corner that has a very, very long list on it of things. All of those things are on there. Currently, we are looking at the commissioning of this as a priority, but our commissioning viewpoint and strategy for the next few years is taking place. We're pulling that together, and all of the things that you've mentioned will be on there.
Okay, next question. You must have a ballpark figure idea already of how many patients you expect to be seen for 1.5 million. Would you share your best guess?
Part of me wants to say no. Part of me really does want to say no, because what I don't want to do is give you a figure at this time that everybody goes away and writes me a response based around. I mean, I think I could tell you the number of patient places that I've lost in the West, but I could also tell you that that number of patient places wasn't sufficient in the first place. We will give you some ballpark figures within the procurement, but what I don't want to do is give you figures that people go away and take as a baseline. I want you to be innovative, and I want you to tell me if I expect to see 8,000 patients going through a practice on a standard contract, how a patient population that is addressing different access needs in an innovative way, utilising practice staff in a different way, I would want you to model some of that for me and come back and tell me what your expectation is as to what you can deliver.
Great, thank you. How quickly would you expect these staff to become consultancy level? Is the intention to train the staff there who join in the beginning, or attract already trained consultants?
I'll let Adrian answer some of that because some of it's outside of my knowledge base. What I would say is that what I would expect initially is for us to be recruiting the staff that we need to meet the access issue. As we move forward around a career pathway, we would need to discuss that and look at what we need to put in place to do that. And some of what we're looking to do is to train and upskill existing practitioners across North Wales. So in part, the answer to your question would be different depending on who it was individually that we were speaking about, but I'll come to throw across to Adrian.
I think I completely agree with you, Pete. Thanks for that. I think it's a phased approach, as we've talked about, phasing actually what this is going to be about, and it actually is about access to first and foremost. Eventually, yes, there will be training of local practitioners by local consultants coming in to teach and upskilling these local practitioners to potentially not necessarily consultant level but to tier 2 level, and then being able to award contracts to them within their own practices potentially. So it's a cycle that will start very, very slowly, but eventually will generate other individuals within their own practices. And as you well know, the Healthy Wales document and the Welsh Government, it's about promoting primary care, utilising primary care to its full effect rather than referrals onto secondary care. And this is what this process starts.
That's great. Thank you, Adrian. Next question. There are already 7 dental foundation practices in North Wales. How many dental foundation seats at this practice?
I guess that's my department again. There's actually 8 foundation dental practices in North Wales. With addition to that, we managed to secure some funding for dental clinical fellows this year by top slicing some money from Welsh Government, and Colette was really grateful to offer 2 dental clinical fellows. So actually this year we've had in some respects 10 foundation dentists. Funding for 2 further foundation dentists has been allocated to North Wales, and therefore this can be potentially utilised in the dental academy. Although it's really important to remember and to mention the method of selection of educational supervisors in Wales is via quality assured process. It has to be effective and equitable across the whole of Wales. Nevertheless, though, we're happy to support and direct what is expected of any educational supervisor that applies all the requirements of a training practice. So in some respects, the applicants will be as close to perfect as possible.
Thank you, Adrian. Some great questions coming in, so thanks to everybody who's sending them in. Next one, would the successful bidder be required to work in the premises and perform as a dentist and also be an educational supervisor to foundation dentist in the academy?
Yes, I'm gonna go with a bold yes, but then I'm going to qualify my answer. So I would expect that the successful bidder for the practice will work within the practice. I'm not looking for an absent caretaker manager here. I'm looking for somebody who wants to work with us, and by us I mean North Wales as a whole, to benefit the whole dental landscape in North Wales and drive that forward. So I would expect either the successful bidder to appoint a lead who is full-time based within the practice and working within the practice and working with us. That person may or may not be an educational supervisor, but we would expect an educational supervisor to be in the practice and working with the DFs that are within the practice.
Okay, this 1.5 million is clearly made up of money from lost GDS contracts to date, but there is additional funding too. What's the split, please?
All of the funding comes out of my North Wales dental budget for the delivery of GDS services.
Great. If we are working closely with yourself, we will be able to influence the direction that the GDS reform programme goes, i.e. if we have an idea, we can share it and it is heard.
Absolutely. I think I should probably expand on that, but yeah, absolutely. I mean, that is the whole idea here. You heard Paul in his video talking about being the flagship and pushing contract reform and how we can help assist Welsh Government in delivering the contract reform agenda. My ears are always open to good ideas, no matter what contract it is that you're working under currently. I don't think there's a closed door to good ideas. So yes, absolutely.
Are you looking at recruitment in a broader context, such as working with secondary schools, dental schools, a Coleg Cymraeg, etc., to make North Wales a sought-after career move? This could also help retention if recruits are already bought into the area.
Yeah, absolutely. There's a number of programmes ongoing currently within the Health Board, working with organisations locally around discussing careers in health and how attractive they are, and getting out there when people are young and getting them to think about careers that maybe they hadn't thought about previously. And obviously we will look to continue doing that and extend that further around dentistry.
And just to add on from that point of view, HEIW are also involved in that process, you know, and we're actually pushing for the 7 project and train work live. So utilising, you know, individuals from an area to come back to an area to work.
Perfect, thanks Adrian. If it's envisaged that the new practice will work closely with the local health board, can we be assured that they will neither receive preferential treatment or be disadvantaged compared to GDS colleagues already working in the wider area?
Yeah, again, yeah, absolutely. I mean, what we're talking about here, for me, is the general basics of contract management. All of our contracts should be, or all of our contractors should feel able to work closely with us as a health board around issues that they may have, developments, anything that they want to talk to about ideas, similar to the question we just had around sharing ideas and taking them forward. I'm not looking to introduce a different relationship here. I'm looking to change the relationship that we currently have, but I'm also recognising the need that we are starting something which is unique. We're asking for innovation, and I'm asking for somebody to work closely with us as the health board to develop what it is that we need to deliver here. So in part, they probably will get preferential treatment in some ways, only because we are defining what it is that we're looking to deliver here. If you class that as preferential treatment, then yeah, absolutely. Will I be offering them any level of support, influence, drive, change to their contract that we wouldn't offer to any other GDS contractor across the area? Absolutely not.
Thanks, Pete. Next question. What's the plan to draw staff to this area in the first instance?
If I could answer that question, I would be a very rich man right now, and we would have a full complement of dentists and associated professions across North Wales, and I would currently be asking Chris for a big pay rise to do the same in primary care. I think, you know, the really simple answer, and this is probably me, the excitable project director, rather than me speaking on behalf of Betsi, is the plan is to make North Wales a bloody good place to come and work in an area where we're at the forefront of driving things forward, and where people feel that they can come, start a career and really develop themselves moving through that.
Thank you. Will GDPs be overlooked for somebody with further qualifications?
Absolutely not. There will be no questions in the procurement that are based around your qualifications. There will be questions based around, you know, we touched earlier on the educational supervision, and there will be some of the training related stuff that Adrian can tell you more than I can, that will be essential within the practice, not necessarily within a bidder, but within the practice. But no, nobody will be overlooked because of their qualifications.
That's good. Would there be any restrictions on what could be delivered privately from the practice?
No. I mean, no.
The short answer, no. That's no. Good. Okay, what is your contingency plan if no single provider comes forward with a bid? Sorry for a negative tone for such a positive initiative. Have you got an idea of a group approach, i.e. joint venture between a number of individual players, DF providers, or you're talking to the corporates?
So I'll start with the end of the question first. No, I'm not talking to the corporates. I'm not talking to the corporates. I'm talking to everybody. We're open to any makeup of organisation wanting to put forward a bid. So if there is a group of you out there who want to get together and pull together a joint bid and form a JV to deliver that, that's great. You'll be considered in exactly the same way as an individual practice or a corporate would be. It's a fully open procurement that will be open to all.
Okay, how helpful are Cardiff Dental School being and Liverpool, Manchester?
I mean, the easy answer to that is they're not being helpful because I haven't asked them anything, so they've had no opportunity to be helpful. As we develop and we move forward and we're looking at developing career pathways and looking at partnering with organisations who can help us to deliver that, I am sure they will be great and very helpful in helping us to achieve that goal. But as we stand at the moment, we haven't approached them, we haven't asked them any questions, so they are being neither helpful nor unhelpful.
Thanks, Pete. There is currently no community dental service provision in Bangor or Carnarvon. Is Betsi planning to address this? The CDS provides a lot of support to GDS service and will be increasingly in demand when access to NHS service increases.
Okay, two answers to that question really. So firstly, there is CDS provision in Bangor. There is a one-chair unit on Ysbyty Gwynedd that delivers CDS services, and we deliver GA services out of YG as well. So there is CDS provision in Bangor currently. As I said earlier, we are currently looking across all of our dental services at our provision and our plans moving forward. I've had 3 meetings this week where we've talked about accommodation for CDS in Bangor, so it is on the radar. We are looking at how we move forward. Carnarvon, we are addressing that issue. There is, I can't think of what the place is called. I need Sandra here to kick me and tell me. Pennygroes, we're looking at opening a clinic in Pennygroes to address some of the need in Cardiff and that surrounding area. So we are addressing all of our dental provision, not just opening a GDS practice in Bangor.
Thank you. Did you mention 2 FD spots at this practice? So potentially with the right incentives, this could mean 2 extra dentists within a year.
Yeah, rather, as I said to you, funding for 2 further foundation dentists has been allocated to North Wales and potentially to be used in the Dental Academy. There's a plan for September 2022 because of the way that the timeline works out with the contract potentially starting in September 2021. And actually bums on seats potentially in April. We wouldn't be having foundation dentists into this until September 2022. But I just want to reiterate that there is a quality assurance process that all individuals across Wales go. But of course, we would direct anything we can do to help.
Thanks, Adrian. Okay, will you be looking at providing a dental foundation year for therapists similar to the one run in South Wales?
I can answer that, Pete, if you want. From a point of view, yeah, I mean, the Healthy Wales document is about prudent healthcare. It's about the point of contact being treated by the most suitably trained individual, and therefore HEIW's intention as the educational arm of Welsh Government, we will try and understandably facilitate the best for any particular area. So is there expansion planned for therapy training through the foundation scheme? Not currently, but it's something that we're looking at.
Okay, next question. Why is Bangor University offering 15 hygiene places instead of therapists? I think we've...
I can possibly take that one, Becca, if you can hear me.
Go ahead, Chris.
So the reason we're doing that is simply to do with the commissioning process at Bangor that Bangor University's followed. So the way it works is that the way it works is that the bids are allocated into specific lots by HEIW, and we're able to allocate to bid for what's been apportioned. And it was part of this commission process. There was 15 dental hygiene lots available, so we went for the full complement, but there weren't any dental therapy lots available. It's very much the ambition of Bangor University and the All Wales Faculty for Dental Care Professionals to aspire to dental therapy training. And we think the Commission will be looking quite closely at our ability to deliver dental hygiene when it comes to the next commissioning cycle, where we hope we'll have the opportunity to bid for therapy, but it's very much on our agenda.
That's great. Catherine's just replied, that's great news. Great news. Hygienists are great. Hygienists are great. Therapists can do so much more. That's great. Okay, I'm going to bring in Welsh Government at this point, since there's no more questions on the chat, but feel free to keep posting them in and we'll ask them for you. A couple of questions that were asked earlier for Welsh Government. What does the Welsh Government expect to see from the North Wales Dental Academy? I think we've got Paul Brocklehurst on.
Yes. Yes, Welsh Government what do we expect to sort of see? Basically, first and foremost, this is about improving access to patients in the west of North Wales. But as Pete has mentioned, we'd also expect to sort of see innovation in the provision of care in critically a non-UDA environment, for picking up on all the developments around the contract reform. So that's about making the best use of the whole of the dental team and technology to promote remote access as well. And then the linking of service provision with the educational opportunities that Adrian has been talking about, and also that Lynn has mentioned as well, to really sort of develop dental teams in the north, their capability and capacity.
That's great, thanks Paul. And while you're on, I'm also going to ask you, what is the future of contract reform in Wales, just in case people aren't very clear on here?
Thanks, Becca. So contract reform is a key priority in Wales. Obviously, at the moment with the COVID pandemic, we're sort of battling with that, but there's plans afoot. So strategically, we see this to delivering to the policy objectives that I talked about in the slides. So ultimately, increasing access to new patients, delivering prevention, extending the use of sort of skill mix, high quality evidence-based care, and of course, care according to the need as defined by the ACORN toolkit. So as contract reform restarts, it will really be focusing on moving away from a cure-based culture linked to UDAs, much more towards a care-based culture, focusing on improving patient access, as I've mentioned, and the quality of care provided. We have been developing 2 new care pathways, one of which actually started its development in the north with a group supported by Bangor University and the Welsh Government. So we've got 2 care pathways, one in caries, one in periodontal disease, which will drive this transition and build on the existing ACORN tool. And then this will later be reinforced by the quality measures that will focus on incentivising the structure, process and outcomes associated with those sort of policy objectives that I outlined earlier.
Thanks, Paul, that's great. And also, just while you're on again, what is the Welsh Government support for the project?
Okay, just muting myself. So aside from the 28 million that the Welsh Government provides to fund NHS dentistry in the north, we're making an additional investment of £250,000 per year for the North Wales Dental Academy. So BCUHB, as you know, is an autonomous NHS body, but we would expect to see the commissioning of NHS dental service to meet the needs of the local population, whilst providing educational opportunities for the whole dental team. And one of the things that we're doing in the spec is actually detailing those needs, so that you can then look at developing an innovative model to meet those needs.
Thanks, Paul. Okay, going back to the live questions, are we able to get copies of this evening's slides, and when and how will the tender be issued? One for Pete, I guess. Yeah.
Yeah, I was hurriedly typing away there to type an answer, and you beat me to it. Yeah, we'll send the slides out afterwards. I'll write up some content for mine. I was just really keen that we didn't have a little bit of a death by PowerPoint this evening with my element, because it quite easily could have been. But I'll write up some elements of mine and we'll send those out probably early next week, I think. The procurement will follow the usual route. It'll be advertised in all of the usual places, but we will send a message out to everybody who has registered for the event today, letting them know when that procurement goes live and where it is.
Thank you. Okay, there's no more live questions at the moment, but feel free to keep posting them if you have any more questions. I'll move on to some questions for HEIW for Adrian. What support will I receive from HEIW?
As mentioned, HEIW's philosophy is to transform the workforce for a healthy Wales, which underpins that Welsh Government document, A Healthy Wales. As I mentioned, we are the educational arm that supports the future dental contracts set out by Welsh Government. HEIW's ideals is to improve quality and safety by supporting the NHS to build a sustainable and flexible healthcare. And therefore, our role is to support all involved in this process via education and training. Our plan to support all dental professionals and new and established practices is multifaceted, and this includes the quality assurance of any training provided, upskilling our DCPs and dentists for the next generation, and utilising quality improvement, and of course enhancing primary care as set out by the Welsh Government vision. So we've got extensive processes in place to support learning to enhance the needs of the local population. So in synopsis, to answer, yes, HEIW will support any practitioner or DCP in their learning journey, and the Dental Academy is the ideal place for this to happen.
Thanks, Adrian. Does this initiative also include the potentially vacated contract by Bupa in Carnarvon?
This initiative covers the activity that was lost in Bangor and Menai Bridge, with additional funding from my dental budget to top that up to a level that's suitable for what we think is the right level for the delivery of what we're asking. I can't comment on anything that is or isn't happening around individual contractors' contracts.
Okay, a couple more coming in. Recruitment to the west has been, oh sorry, they're coming in thick and fast, they've gone up for my scroll. Recruitment to the west has been extremely difficult. Will the local health board support and be active in the remittent process of dentists to this project, or will it be all left to the successful bidder?
I will go back to the question that was asked earlier around operating too favourably around this contract over others. We will offer the same level of support to whoever it is that is successful in bidding this as we do to any GDS contract where there are potential issues. That may not be very much at the moment, but we would look to do everything that we possibly can to support that, but we wouldn't do anything that would favour one practice over another, because I'm aware that there are a number of practices in the West that have vacancies they'd be looking to fill.
I think, again, sorry, Rebecca, just from this year, from a BCU point of view, as a dental practice advisor, as you all know, we managed to recruit in the West quite easily this year with some new initiative, and therefore potentially with this type of contract that's been available, there is that potential, I think, to pull people in. New graduates are wanting places to work where they're potentially salaried or have the ability to link into academic institutions, and the process this year of the dental clinical fellows has shown that this process does work. So I think recruitment is always going to be an issue, but I think if you think of innovation, you think of a different way of working, I think you'll pull people in.
Thanks, Adrian. And another one for you. What is HEIW position on incentives such as bursaries to aid recruitment?
Yeah, HEIW don't now offer any bursaries for individuals for relocating. I think, as I say, I go back to just my previous point, this new innovation, utilising HEIW, utilising Bangor, utilising this practice and BCU, and what Welsh Government is offering, I think potentially is more an incentive than actually necessary monetary value.
Okay. If we do not go for the tender, is there any way we can become more involved with GDS reform and North Wales Academy? I think everyone has plenty of ideas, but we don't know who to share them with.
Okay, at the risk of putting myself out there, there's two elements to that question. So can we get more involved in contract reform? Absolutely. Paul's still here, so he would make my life a misery if I didn't say we would absolutely welcome and support anybody wanting to find out more and move towards contract reform. For the second part of that, if you have ideas that you want to share and you don't know who to share them with, and this is the bit I may regret at some point, I'll stick my email address in the chat if you can't find anybody else. So if you're, I would say normally share through your contract officer route. But if not, I'll put my email address in there. If you've got ideas or you want to start a conversation, just drop me an email.
And just to add to that, Pete, if we take the examples of the caries and the periodontal care pathways in their initial design, the periodontal pathway was designed by a group in the north and the caries by a group in the south, both composed of practice owners, associates, dental hygienists, therapists and practice managers. And then that has also gone out to a broader group of people in part of that testing phase, in the early sort of testing sort of phase. As we release those, again, you know, feedback is very much welcome on all of that from the Welsh Government's perspective.
Thanks, Paul. Could Adrian elaborate on how they recruited more in the West this year? Adrian?
So we recruited two individuals, really two lots of individuals this year. So we recruited more foundation dentists this year, and that was probably me sending information going out to practice. So we actually got another foundation dentist on the island this year. So that was the first point, and that was probably just you know, in an individual applying. The dental clinical fellow positions, as I go back to, if you look at GDP UK, what new graduates want from after qualification, they want a salaried position, they want to upskill for the future and want to improve their education, and they don't want to work a full week, don't we all? So actually, if you can offer these type of things to new graduates, then there's the potential that they will come. So what we did this year, as I say, we managed to negotiate some money from Welsh Government for these two dental clinical fellow positions. And what the Health Board did to try and improve their education is we signed them up to a PG cert of a particular area that was really needed in North Wales. So we've got an individual who's doing PG cert in oral surgery, and another one that was potentially going to be starting as a restorative, but of COVID has been a little bit of an issue. But we actually drew people to the area, offering them education in a salaried position. The idea is that these individuals after a PG cert would potentially stay for a PG dip or even a master's, and at the end of it we can negotiate a tier 2 contract with an individual that is clearly trained to at a level that doesn't necessarily need a secondary care referral. So this process has worked this year, and I think that's an idea potentially that could be utilised to improve the access and retention in North Wales.
Okay, I think the dog has stopped barking somewhere. Okay, does the clinical fellow role depend on size of NHS contract, or you are a DF practice, dental foundation practice?
So the foundation process is slightly different because that's run by HEIW. The dental clinical fellow position is through a BCU, so it's determined on QAS return, it's determined on clinical governance, it's determined if the practice is suitable to take an individual. There was no additional funding for UDAs, or one of the reasons for going into it is that you had to be on contract reform, and you also had the ability to take a clinical fellow for 4 days a week. So really that was the only indication. It wasn't, and it's not an educational pathway, it's not a training pathway, it was a fellow that would come and work and do contract reform within the practice, doing service provision, but has the ability to 1 day a week to step out to do some education. And that education doesn't necessarily completely mean it was 1 day a week within a university setting, and our hope is in the future that would be Bangor University, but they were also able to step into consultants clinics within North Wales, utilising as our locally trained network.
Okay, great. So, sorry, yeah, go ahead, Paul.
Yeah, no, it's fine. Can I just add again to Adrian's thinking there, because I think there's real opportunity here working with HEIW and Bangor University to really sort of develop and put dentistry on the map in North Wales in relationship to education and indeed research, if that's your bag. So there's lots of opportunities that we're exploring to really create a structure to facilitate that. So I think that's a really exciting opportunity, and there's a lot of things which will flow out of this, I think, over the next couple of years, and all that will be linked to the North Wales Dental Academy.
Perfect, thank you. I don't think you've answered this one quite yet. Where are these clinical fellows people actually located, Adrian, and where are they providing services?
In the West, on the Isle of Anglesey.
Great. Okay, worst case scenario, what happens if there is only the tenderer and the foundation dentists and no other dentist, therapist, hygienist? Does the contract value stay the same?
Absolutely not. So in line with any other contract that we let, the contract value is matched to the capacity available within the practice. So in the scenario that you outline there, which I know we're saying worst case scenario, you'll give me bad dreams tonight, even just writing that down and putting it in front of me. But in that scenario, we would adjust the contract value to the capacity available within the practice and have discussions with the practice around how we support them to move forward in the same way we would with any other practice currently.
Sorry, Becca, can I just add there, which I haven't mentioned, is that, as you well know, foundation dentists come with their own funding, and that is through HEIW. But as I previously said, the funding wouldn't start until September 2022. But on average, a foundation dentist brings about £120,000 worth of funding into the practice each.
That's great. Thanks for clarifying that. Okay, there's no more questions on the live chat. I will going to bring in Bangor University if that's okay. I've got a couple of questions here. Maybe Chris can help, or Fiona. Which education programmes will the North Wales Dental Academy be linked with?
Yeah, I can pick up this one to begin with, Becca.
Thanks.
So it's really this links back to the point Pete was making at the very beginning about a phased approach between access and then training for the academy. And from the get-go, from the very initial point of the academy, we'd really like to see the academy linked with the dental hygiene programme that we've talked about. And Lynn mentioned quite extensively. We've bidded for as many hygienists as we're able to bid for. And one of the main restrictions or limits on our capacity to deliver that is actually how many we can place in a clinical setting. So we'd expect the Dental Academy to take on a number of that dental hygiene cohort each year on year, so that those students have provided for them as a minimum exposure to a truly innovative contract reform based academy practice, so that we can guarantee that all our students come out with exposure to truly contemporary ways of working. And then there's really the more, the less bread and butter side of things, the more exciting elements, which are where we start looking at the later phases of the academy, and we're talking about opportunities to get involved with more innovative education programs that we're working on at the university, not just through the All Wales Faculty for Dental Care Professionals, but also with colleagues within the school, linking to the clinical academic pathway, where if clinicians, and this is any member of the dental team, I want to make that very clear, if they're interested in pursuing research or academic routes, linking with Bangor University and the academy from a clinical perspective, then we've got pathways for them to do that. We're also looking at opportunities. We talked about dentists of special interest, but also looking at future options for DCPs with special interests, and that would be a really exciting link between the university and the academy. I think we mentioned earlier as well our ambition to bid for dental therapy when that becomes available, and obviously the associated education and clinical support that goes alongside with that would be perfectly suited for the academy. And then on a sort of lighter note as well, we're producing a number of online, virtual, dispersed learning packages at the moment. We call them MOOCs, where we can expand our reach, not just within North Wales, but actually beyond, and actually really shine North Wales and Bangor University, and ideally linking with the academy as a beacon for education nationally and even beyond that through our education that's delivered online. So there's lots of opportunities there for linking up with Bangor University, and as the discussion's been throughout the whole of this evening, it's an open conversation as well. We like to take ideas of how we can embed education and deliver something that actually works for the workforce of North Wales.
Thanks, Chris. Okay, another question just popped up. Is there any ortho element to this initiative? I don't know who wants to answer that one. Pete?
As we sit here currently, no. Hasn't crossed my mind. It isn't anything that we've looked at up until this point. It would be something I would need to go away and think about, and we would need to think about what the benefit would be at this point. We've talked about phasing. It may well be that an ortho element phases in at another point, but as we stand currently, it's not something that we're considering.
Okay. Will the number of patient contracts expected for the 1.5 million be in the information given in the information package before the tender process?
As part of the tender process, we may supply some indicative numbers of what we would expect to see in a traditional practice in terms of patient numbers for the contract value that we are looking at. But I would not expect to have a direct link between that. As I've already said, we're looking for innovation, we're looking at different ways of working, and we're looking at how we measure things differently. So I would not expect to draw a direct correlation between indicative numbers that we may supply around what that would translate to in a traditional practice setup to what we're looking at in this contract.
Okay, thank you. I think I've actually run out of questions unless anybody else has got any more to send through.
And we'll give you 1 more minute to send through questions while I do a little bit of a waffly wrap up. So anything else, just throw them in and we'll answer them before we end. But personally, I'd just like to say thank you to all of you for 2 things really. One of them for attending and listening to us talking about what has been probably up until today still something that we've been formulating and trying to push forward, and that's been an idea and has suddenly become a lot more concrete today when we've had to sit in front of you and talk to you about it and make it a real thing. So thank you for that. And secondly, thank you for the questions, because they've been interesting, informative, slightly challenging, all of the things that I really like in an event like this. So thank you for joining us. Thank you for interacting with us. It's a Wednesday evening. My mind's probably been on my tea for the last 45 minutes. So thank you all for giving us your time. And yeah, thank you. We'll wrap up there. We'll send you out. We've got social media presence as well, so we will send you out all of the links to the social media when we send out the slides and the Q&A as well. So thank you and good night.